Ok, io presenterò la prossima.
Let me introduce the next paper. I believe who has been, it's some study by my dear friend Alan, who's been invited here by Vincenzo and SICSSO, but unfortunately he had some problems, so he couldn't attend personally this conference and present his talk. But his talk is really, really interesting because it has to do with the viability of endothelial cells, globally speaking. Okay, we have already seen the evolution of the EK. Now we see the transition from DLEC to DSEC to DSEC and DMEC. And as Donald Tan, this may reduce the rejection risk. But still, we have to see how many endothelial cells can be lost during harvesting and surgery, because the more cells are left, the greater the success rate in the long term. So the most important steps are the preparation of the tissue, the storage of the graft, and the actual surgery. Let me now show you the curve. This is the background cell loss induced by surgery, and then the combined cell loss. That is quite sizable, as Jonathan has already explained. We know that there are methods to assess the cellular viability prior to implant in vitro, but what Bogal has spent 3 years into studying is a method to assess the global viability of the cells with a vital nuclear staining. So this is, it rests on a concave surface. In red, we see the lost cells. These are the stress lines, where the stress cells and the unstained lines represent the healthy cells. In fluorescence, we see in red the entirely healthy cells. In green, we may see the proliferation surrounding them, and the rest is the lost cells. During a short study on animals, we've seen that stripping seems to have the best possible results in terms of bubble, because especially when the air is injected, we see that there is a considerable loss of cells, whereas peeling contains or implies considering cell loss during the membrane stripping. And then what is also very important is the tissue that has been stripped by the eye bank, but then 10-12% of endothelial total cells are lost, however, and this loss is higher when if you compare the peeling versus bubble technique. And here we may see more images showing, for instance, once the graft has been stored into the appropriate medium, that there is, however, a minimum loss of cells. You may see here the peeling and the bubble techniques compared to each other. So the preparation, more or less, we might say, it accounts for 15% of the observed cell loss. The rest is caused by surgery. So that's a use. It might be interesting to see what happens when we have problems in unrolling. How many endothelial cells are actually lost? The problems with current in vivo assessment methods are that confocal microscopy and specular microscopy cannot always be performed, especially in case of corneal edema. The cell density is assessed only on a small portion of cells, and so we presume that the same applies to the rest of the cells, but we do not know for sure. And so Bogal has developed this in vivo method to assess the viability of of cells in pigs, and the same method has been used in the past for training purposes, and the lens capsule in pigs has been used for this purpose. So this is the HRT, this is the donor's cornea, this is the mounting chamber, and this so this is also very important. So obviously this is the human limbus, the one we have considered for the study yesterday. We have showed the tapping and the unfolding. This is the manual maneuver that Dr. Strigo has showed us previously. So this is how the chamber is mounted in the front of the device, and this is the same example of unfolding. And so the rabbit has been kept alive 1 month after surgery. So these images have been collected in order to assess the global viability. How can I go back? So after 1 month, prior to sacrificing the animal, we assessed the global cellularity within the graft once inserted. And here, this is the technique that Mike Strigo has shown, working perfectly, so S marking here. But in Murphyville, we usually also have a peripheral triangular mark, which in our hands works quite well. So trifiniation, 30 degrees scalpel cutting anti-clockwise, a triangle. And then the peeling is performed, and then it is stained, and then it is inserted with different techniques. This is a patient showing clearly the mark. This the mark clockwise, and so since here the tissue is more clear, it is more difficult to be seen, because probably we cannot do such a good job as the eye bank, but sometimes having double marks can help. Now, here I shows how the marking should be made anti-clockwise. Complex cases. Why is it important to assess the endothelial cells? Because this is a case when the surgeon did not flatten the chamber. This has already been shown by Strigo. And I show you now a simulated case in a rabbit. So we have simulated here the same case out and then back into again. And then we have assessed the global endothelial cell count in vivo, the new technique, and that's the result. Of course, there has been a considerable loss of endothelial cells, but this graft, however, can survive, but probably for a shorter term, unless, versus a graft that hasn't suffered all these traumas. So, in summary, this method can be used and useful to evaluate new surgical technologies, to see what, or to predict what the cell loss can be, and might be a helpful aid for beginners in DMEC, of course. And let me say that this work has been done mainly by Manny Bogada. I simply presented it because Bruce couldn't attend this meeting. Thank you.